brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, half a day, everybody. Welcome back to Healthy Living Tuesday. Dr. Jitka Lom is here, and Doc, we are talking, of course, about irritable bowel syndrome. Some fascinating information you gave us in the beginning about generally what it is and how it's treated. We have some good Facebook questions. You ready to go?
Sure, yep.
All right, so question number one is for you. How important, Dr. Lom, is diet and stress to preventing irritable bowel syndrome?
Well, prevention is hard because we don't really know the cause, but certainly, of course, it's best to have a regular lifestyle with no stress, and that's really hard to achieve these days. You know, as far as prevention, I'm not sure, but if you already have irritable bowel syndrome, then it is super important for you to maintain a very regular lifestyle with as little stress as you can, with lots of good rest at night time, exercise, and a good healthy diet for sure.
And again, as we covered, you can literally worry yourself sick.
You can, and people do, you know, when they generate very negative toxic thoughts, chemicals are created in our body that travel from our brain down to our body, and for example, they will create a lot more acid in your stomach. So you might notice that when you get very angry, you will experience heartburn. When you feel upset, you may have palpitations, or if you're nervous, you may have butterflies in your stomach. These are because chemicals are released because of your thoughts. You're worried about an exam and you start getting, you know, jittery. So you can certainly get sick from your thoughts. So you must be very careful about what you're thinking about.
Good tip, very good tip. All right, question number two, Dr. Lom, is will IBS cause permanent damage to your colon?
No, that's the beauty of it. It won't. You'll be perfectly fine. You'll look well. Your colon will look great. Everything will be fine on the outside. It's just you won't be feeling all that well. So it won't shorten your life. It won't cause you to have any surgeries or unpleasant procedures. It will just probably cause you quite a bit of worry, like we were just mentioning.
So, and as you said, you know, you don't walk around with fevers. You don't have any of those side effects. It's just an abnormality that you have.
We call it a functional disease. So meaning that the function of the colon is not normal, but there's nothing to be seen, or there's no blood test that will tell you about it. It's just how you feel. So you have to work with somebody who's going to listen to how you're feeling and hopefully help you feel better.
Okay, sidebar question real quick. Is it hereditary?
It does run in families a little bit, and it tends to affect women much more than men.
Okay, question number three. If I have IBS, does it increase my risk of colorectal cancer?
No, thankfully it doesn't, not at all.
Okay, all right, just simple as that.
Yeah.
All right, let's go to question number four now. Dr. Lom, how do I know if I have IBS or do I just have gas?
Yeah, that's a tough one. Gas, you know, gas is generated in our intestines when we're digesting food. That's the byproduct of bacteria and from degradation and from digestion will create gas. And so it depends on what you're eating and also what kind of bacteria you have in there. So gas by itself is not the only symptom of irritable bowel. You also have to have the diarrhea off and on with the constipation and pain. Gas is not always painful. People just pass gas. And so if you are somebody who, as a sidebar, does pass a lot of gas, most of the time it's because you're constipated. And I always talk to patients about this every day, where they'll say, no, I'm not constipated, I go every day. But the amount that you go may be less than you need to go, and also your stools may be quite hard and difficult to get out. So every day you should have a nice, soft, big one.
Is your flatulence any more or less offensive in terms of like odor?
Yes, if people empty their trash daily,
yeah,
you're going to have less odor.
Hence the smell, because that's
smell,
what picks it
up.
Yeah.
And people that eat more vegetables will also have less of an odor there. People that eat a lot of meat will have a stronger odor.
All right, I'm sure our viewers eating dinner right now,
Yes,
listening to this,
that's
are enjoying this conversation mightily. Okay, for those of you still watching, question number 5, can IBS be an indication of a more serious condition? We kind of touched on this.
Yeah, probably not anything lethal, but I think, you know, you will end up getting a whole bunch of different tests done to rule out all of those other diseases, including celiac disease and the inflammatory bowel disease. The one thing that you should always watch for in your stools is blood. If you have blood in your stool, that's one that really needs to be checked out carefully to make sure that you don't have colon cancer.
All right, and our last question, are there any alternative options for treatment rather than medication, possibly something maybe holistic?
Well, they do fiber, you know, the high fiber diet. Some people will try acupuncture, hypnosis, meditation, crystals. People will try just about anything to try to calm down their pain and their irregular bowel movements. The beauty though is that the medicine really does work really well. If you might have to try one or two or three different ones, but when you get on one that works, it works well. So that's a good thing and a nice piece of hope for those who are out there.
All right, we got a small chunk of time now. If anybody would like any more information about IBS, because so many people say, I went to webmd.com or I jumped on Wikipedia and everything, and they found out that the common cold, it freaked them out, like they thought they were going to die, just from coughing twice.
Yes.
Where can people find good, reliable information, not only about IBS, but about other medical topics?
Okay. Well, I guess you could always go to, as far as IBS, there's the Irritable Bowel Syndrome Foundation. That's a not-for-profit. And as far as other reliable sources of information on the internet, I guess WebMD actually is not bad at all. The other one is Mayo Clinic. You can always Google there, and they're usually quite up to date as well.
Okay, Dr. Lom, always a pleasure. Thank you so much for the information.
Thank you so much.
All right, and sit tight because we will be back. Healthy Living Tuesday continues when we return.